Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. And today's Friday, September 17, 2021. I want to thank you for joining us this afternoon. And I want to talk about and just thank first our friends in the community in Northeast Texas who continue are doing things for our staff and our physicians. We truly appreciate. I want to call out Kelly Baker and her friends for bringing boxes yesterday of goodie bags for our nurses of just different sayings and different goodies that were in those bags that we passed out to the team yesterday. So it was boxes full of those goodie bags, and our nurses were truly appreciative. So thank you, Kelly, and your friends who put that together. We're truly appreciative. Well, I also want to say thank you to our friends at Cypress Basin Hospice and Diamond C last Friday who put on our snow cones for our team members as well. So it was anytime our team members have the opportunity for food and especially snow cones on a Friday afternoon, it's always positive. So we're appreciative of both those organizations working together to provide that last week. Also want to give a shout out to our EMS team. You see Angela and the team there. Last week they had the opportunity to go out to Expectant Heart Pregnancy Resource Center here in Mount Pleasant. I've become familiar over the last week or so with this organization. They were at an event yesterday in Pittsburgh, and they're doing some great things. And we were excited that our EMS team was able to go out and talk CPR with that group and their patients and their members who are part of that. So it was exciting for them to be a part of that last week. You know, one of the things over the last 7 days since my last update, I've been asked by several members in person and text, and just talking about what we've been saying for the last few weeks and really questioning, are we giving you the company line? Are we just giving you what the state wants us to give or the federal government wants you to hear? And I want to make sure that everybody understands who get these updates. We do not. And, you know, my questions I ask myself and I wonder all the time, you know, are we just beating a drum by saying vaccinate, mask, social distance, or are we providing a drumbeat? And that's kind of what our goal here is. And one of the things that we've tried to do over the last 16, now 18 months since this pandemic started is use Facebook and these lives as a way to be transparent, to a way to communicate what's going on within the health system. I have the esteemed privilege of being able to participate in meetings on a daily basis, whether it be with the federal government, with the state, with our region, our physicians, our nurses, our community, and our disaster emergency team here in Titus County. We want to use this platform in order to get that information out there and to be transparent. One of the things we want to make sure we're giving is all the information and not just the company line, not just what the politicians want you to hear or you think somebody learning. And we try and provide both sides, not just one side. We're just not telling you the good and not sharing the bad. We've tried to over the last 18 months is share what we're privileged to see and hear. Last night I was honored to participate in our medical staff meeting. Between 40 and 50 of our doctors and AHPs have a quarterly business meeting. Majority of it was talking about COVID. And it was fascinating to sit and listen as a fly on the wall to the physicians in our community talk about COVID, talk about the Delta variant, and talk about the impact in Northeast Texas. None of these physicians had a bias that was political based. Their experience that they've had since medical school and seeing patients and what they're seeing now in Titus County, in Mount Pleasant, that's what they discussed. They discussed their JAMA articles that they've been reading. They discussed the new variants that are coming out. They discussed the things that they're seeing from their colleagues and hearing from their colleagues and looking at different research that's being done, and they talked about it. It was a collaboration that was fascinating. And I can tell you that as a member of Northeast Texas and Titus County, we should be blessed and should be honored to have these physicians in this area. And our goal is to get that information out to you. And these members of the medical staff at Titus Regional Medical Center are doing everything they can to keep our numbers from a mortality standpoint low. Our numbers in Northeast Texas remain the lowest for Titus County of Northeast Texas, even though our COVID per 100,000 is the highest. One of the things I wanted to share as we look at the fourth surge, we have 17 members, 17 people in the hospital today. The numbers drop. And when you look at the state level and Dallas and the Tyler, the numbers have dropped a little bit over the last 5 or 6 days. I had a CEO in Dallas say on the phone call on Tuesday, though, let the state know, don't take those numbers as a decline in COVID. take those numbers as an increase in mortality. And it got me to thinking, and one of the things that I've seen over the last few weeks here and saw is just, what are our mortality numbers? And I just wanted to make sure we communicate that out. And as you can see, from a September standpoint, we've had 13 deaths. And you can see the majority of those deaths have been related to COVID in our health system. So that's the reality. And I want to make sure we give you the truth and give you both sides of it. But we have seen an increase halfway through the month, and we've had almost as many COVID deaths as we've had in the previous 12 months. And then almost as many deaths as we did last month for the full month. So I'm not trying to scare you. I just want to give you the facts, and I want you to make sure you understand it. From a COVID perspective in Delta, more people are getting COVID right now than they have at any point. Fewer percentage are being hospitalized. That's true. But of those 5 to 7% who are being hospitalized, a higher percentage of those are becoming really sick. And we've seen some really sick patients. We've seen patients show up in our doctor's office in the last few days in 48 hours, turn 100 degrees the other direction, 180 degrees the other direction. So it's real. We want to make sure we get that out there. One of our doctors shared last night that Delta is 1,000 times higher viral load than the previous ones that we've seen. Yes, fewer people are being hospitalized, but the ones that are being hospitalized are sicker. And we want to get that information out there, and we want to make sure you understand. One of the things that we want to keep pushing out is our vaccination rate. From the standpoint, I was on a call a few minutes ago with the state of Texas, and we're starting to see from a number of the state of Texas is starting to see a little bit of a decrease. When we went region by region, one of the health systems in Northeast Texas spoke up about East Texas and said of all their parts of Texas, Northeast Texas was their worst place for COVID at this point. The state people made it clear that it wasn't coincidence that Northeast Texas has the lowest vaccination rate in the state of Texas as well. Irrespective of that, and I didn't like the shot he made, but it was reality. Our vaccination rate in Northeast Texas is 47% one dose eligible compared to a state average of 70%. Titus County, for the first time of us tracking this, and when we started late behind, we're above 50% in first dose eligible, and we're higher than the regional's average. When you take into consideration the number of people in Titus County who have been COVID positive, we're getting a higher number, and we're getting closer to that herd immunity. I would encourage you, if you haven't been vaccinated, to be vaccinated, but we want to make sure we share that information with you as well. One of the concerns that I have, part of the meeting today, we started late today at 2:45, because we wanted to attend a meeting about the monoclonal antibodies and Regenron. We've given about 15 Regenron treatments a day for the last 4 to 5 weeks. Our health system has been aggressive on Regenron. We believe it's kept a lot of people out of the hospital. We believe it's kept a lot of people alive. One of the concerns this week was on Tuesday, and the company making Regenron stopped production and distribution. Sent the federal distribution channels into disarray. So the last 40 hours have been very concerning, and now the distribution of Regenron is going to be put at the state level. It's concerning for us. We've been receiving a shipment every week for the last 3 or 4 months, very, very consistent, and right now we don't know. We have 35 doses left, and once those are out, we don't know if we'll be able to get it. I can promise you we were on the phone yesterday with the state and the powers that be, making sure we spread our message, making sure they know that this rural hospital in Northeast Texas, don't forget about rural. When you give the allocations to the urban, make sure the rural communities get the allocation, and we need it. So I can promise you we're doing everything we can, but you are going to hear people that may say that they don't have it. We're going to have to go to Tyler or Dallas for those treatments. We hope that's not the case, and we're working with the state. But I will tell you, it's a concern of ours. I want to make sure you know about it, and you'll start reading and hearing more about it. One of the doctors talked again last night. We encourage you, if you show any symptoms and signs, please don't wait. Day 1, day 2, day 3, get to your doctor. Talk to your primary care physician. See a physician to get on medicine as quick as possible in order to mitigate the spread of the virus. The booster information, we should know more by Monday. The FDA met today. There's a process of still meeting. I tried to look on Google right before I came over here just to see if there's been an update, and there has not. But we expect the FDA to meet today to talk about it. And TDM, Texas Department of Emergency Management, is supposed to meet next week to talk about the booster information from the FDA, from Pfizer and Moderna. So there'll be more information about the booster in the next week. I know a lot of questions have been asked And so we'll try and get that information as soon as possible. Our vaccine clinic remains open. Please encourage you Monday through Thursday from 7:30 to 1:30 at the Medical Plaza or the Wellness Center just west of the hospital. On Tuesday, we open until 7 o'clock, so they stay late on Tuesday. Would encourage you, if you have not got your vaccine there. I want to share a story that I heard this morning, just one of our team members, and I'm truly thankful for all the team members at Titus Regional Medical Center and our physicians that call this health system home. But got an email this morning about one of our nurses who had a patient down in their area this morning, had been overnight and was very sick. And with COVID and everything, there was 2 guests that were just waiting in the waiting room that were normally taken care of. And this team member took those 2 people who hadn't had breakfast or any type of snacks and didn't have any money, and took them down to the cafeteria and made sure that they were fed and had a breakfast and got other items as well for fun. And then also our nutritional team, when they found this out, made sure that those 2 guests left the area with some goodie bags of more stuff from during their stay. And I just want to say thank you to our team members, because even though that team member had probably seen somebody pass away in the last 24 and 48 hours and seen a lot of things going on, the team member took it within their own to help someone else and be selfless. I'm truly appreciative of that. I just want to say thank you. On behalf of the team here at Titus, I want to thank you for this community, for your support. Have a great weekend. God bless.